Medical Association. We provide services to all of the physicians in Saskatchewan, including providing support for e-health integrated services, and then EMR, and then any other digital health related services. Telemerge video conferencing is one of the services that we provide to the physicians, and I'm just going to get started with the training here. Please let me know if you have trouble listening to my audio or looking at my screen here. I'm assuming that everybody here have received the Telemerge video conferencing link so that you can activate your link account. If you haven't, and if you have trouble with your account activation, please let me know as well. I'm going to ask everybody to mute your microphone, just because if we have microphone unmuted, then we're going to hear lots of background noise in the background. So that will be disruptive. But if you have any question, feel free to unmute and then speak up. The session here today will be recorded. And if you have any question or concern about being recorded, please let me know as well. So when you first joined your Telemerge account, you're going to be going into a site address called my.telemerge.ca. When you go to this link on your Chrome, this is the main page. It's going to show up with the login information. So then you're going to enter your email address, and then once you click login button, it'll ask you to enter your password. However, if you signed into the system previously, like for the first time, and then check yourself can be logged in, it's gonna remember your password and your email address. You don't have to enter every time you're logging in, logging out. So this is very handy, and I personally just check this one off so that I don't have to enter the password and username. So once you're logged into the page, this is the main page you're going to be seeing. On the left top corner, the clock icon shows all of the previous and recent calls. So it's going to be listing any calls that you've made using the Telemerge account. And on the second from the left is a phone book. So anybody who has an account with Telemerge, you can search them by name. And then if you can find them, you can actually call them as if you're calling your landline. The benefit of calling using this account is that providers, between the provider and colleague, they can have a consultation or different conference using the video conference technology, and it is encrypted, so it's confidential. The pound icon here, hashtag, is where you're going to be using a lot for your own patient care. I'm going to actually show you this sign on my actual site, not only presentation mode, so that I can actually show you how that looks. This hashtag is for meeting rooms. So it's going to, when you click on it, it's going to show you your name's VMR, which is your name's virtual meeting room. So when you're actually on this page, you can click your Loom link, and it'll pop up with your room link for you to share to your patient. So now I'm going to actually show you on my page how that looks. Oops. There you go. So when I click on my hashtag icon, it'll show everybody's VMR, their virtual meeting room. The top one is my own VMR. So this is going to be where you're going to be seeing your patient, and this is where the patient will come in and join you. The room link I was talking about here is right here. So when I click on that link, it'll give you a link for you to copy. So I can copy the link and then use a email account to share to patient. There's advanced room information if the patient feels that they don't want to use a video conferencing technology or don't want to access their laptop, and they just want to have a simple telephone conversation with you, then they can simply just click share this information here, telephone number with the conference code as well. You can copy the whole thing here. There are other ways to join, but we don't really recommend other ways here other than copying and pasting this Roam link into the browser, because this is the faster way to join other than using Skype or other video conferencing software. So once the patient has the Roam link, they can copy and paste this Roam link into the Chrome, and they're going to see this page here that you're going to be seeing, except the left options here, because these are only for provider who has an account. Patients not going to have an account, so they're not going to see these options on the left side of the screen. So they're going to only see your name's VMR and then join through the browser option. When they see this option, they're going to join. Actually, both the providers and patient will click this join through the browser option, and then they're going to join. When they join, I can't demonstrate right now, making a call right now because I'm on other webinar like WebEx line. So what I can do is I can go back to the slide and show you how the room actually looks. So once I'm joined into the room, it's going to show this page. It'll show the landing page if the patient, for the patient. And once the patient has joined, it's going to show the face, like their image of the patient, if they're using the camera. And there's two really important options on this page that you really have to remember. It's the lock button. So once you check that you've got the correct patient for that appointment, by clicking this little person's icon here, it's going to expand into a patient list. So I'm going to show you how that looks. It'll show the name of the patient, and it'll give you an option for you to mute the patient or X out. So you can actually make them leave if this is the wrong patient. Once you've made sure that you have the correct patient list, you can X out this screen and then go back to your main screen and then click the lock button. Once you click the lock button, nobody can join this session even if they have the link. So I'm going to show you how that looks. I'm going to make my room locked, and then what happens is if I try to go into, I'm just going to pretend as if I'm a patient. I'm trying to go and join this person's session. Oops. It'll show that the room has been locked. So patient can't join the room because, clicking this button doesn't do anything until the provider go back and then unlock the room. Once the room is unlocked, then it's going to change to join through browser option. Once you're in this main page, you have a control to either, once again, to make the patient to leave the room and lock the room so that you can secure that meeting. You have the same option on your account landing page. When you go to this landing page under hashtag, under your VMR, you have an option to lock and unlock the meeting room on the top left right corner. And it's going to show you number of participants. If anybody joins the session, it'll show number 1 or 2. If you click this little person's icon, it'll list, right now nobody has joined, so it doesn't show. But if I click on it, it'll show a list of the patient with the name who has joined. The workflow for your clinic can be two options. You can either go to this my.telemers.ca. Before you join the browser option, you can check your patient list on your page and then lock the room and then join through the browser so that you can be in the room after you've checked everything. Or you can just click this join through the browser option, and then once you're on the landing page like this, then you can check your patient list and then lock the room. So either way, it does the same thing. So it's just your preference. Some people like to stay the meeting room open because they're constantly getting patient. one after the other. So if that's the case, you can leave this link open so that you don't have to go back to your main landing page to join through the browser. You can stay here as long as you can go back to the little person's icon and then X out the patient so they can leave the room before you unlock it. There is something to note. If you don't unlock the room, then nobody can join the session. So you have to make sure once the patient left the room, go back to this little button and then unlock the room. That's the most important things about this, this conferencing tool. Nothing really difficult, but those are something to keep in mind. Unfortunately, the room link doesn't change for every patient. So anybody who has the generic link for the provider, they can join the session. And once the patient has joined, it's going to show the patient's face once again like this in a bigger screen. And I forgot to mention one more thing. When you're on this main screen, there's a setting button where you can check your microphone and your video setup. So if you have, it'll on your Google browser, it should actually pop up automatically when you use it for the first time to allow your microphone and your video. However, if it doesn't and somehow you have trouble connecting your audio and video line, then you can go to this cogwheel, like setting button, and once you click that button, it'll give you an option for you to choose your audio and then video. If I click here, it's not going to work, which I can show you that setting, but once you click that option, it'll show you the list of your audio connection. If you have a Bluetooth, it'll show you your Bluetooth, just default microphone and all that. So you can just pick and choose which one you want to use for both audio and your image. And I have this information for you. If you need any support for Pexip, SMA is there to provide one-on-one support. However, if you're looking for support like more of in the evenings, then these are the hours for eHealth for the provider, and you can simply contact eHealth Saskatchewan at this number or email, and then there's a weekend line as well, weekend hours. For the patient, if they have an issue connecting to this your room, for some reason, they can reach out to Telemerge vendor directly on this number, and these are the hours, 8 a.m. to 8 p.m. To get more comfortable with this platform, feel free to share your room link with your colleague or family member and try out before the appointment. Or if you want to have a one-on-one individual training with one of the SMA practice advisor, you can send an email to emr@sma.sk.ca. Once again, it's emr@sma.sk.ca. That was pretty much what I was wanting to cover. Thank you so much for your time. Now I'm going to ask everybody to unmute the microphone, and then feel free to ask me questions. Does anybody has any question? I can see everybody is muted here.
I have a question.
Sure.
May I set this up for my physician, or do I have to be a member of the SMA?
You can set this up for your physician. You don't have to be a member.
Okay, but like I don't have an SMA or anything like that for a password.
Okay, so it's the physician who will get the password and account information. So once the patient has that information, then they can use that account for the patient care. As an office staff, they can provide support with the link. They're going to simply share the link to the patient, so you don't technically need an account as an
Okay.
office staff. Yeah,
Okay, thank you.
you're welcome. Any other question?
Can you just go back to the last slide?
Sure.
Thanks.
And let me know if the writing is too small. I can make it bigger. If there is no more question, I guess I can end the session here. Any other last question?
Thanks very much.
You're welcome. And if you do come up with, a question later on after the session, just feel free to reach out to our email here as SME. We'll try and provide you support one-on-one basis. Thank you so much once again for your time, and have a good day and stay safe, everybody.